Good afternoon. I'd like to thank you for being here this afternoon. I want to start out by giving thanks to our frontline responders, our law enforcement, our fire rescue, and especially our doctors and nurses that keep us safe in our community. A special thank you to the Health Department, Dr. Alonzo, who has been with us throughout as our advisor, and our healthcare taxing district. They are our front line. They work every day with testing our residents here in Palm Beach County, our doctors and nurses taking care of them in the hospital as well. They are our heroes. They handle and take care of our issues on a day-to-day basis. That is why our new mobile unit is called Hero. And on that note, I'm going to turn it over to Darcy Davis, who is the Executive Director, CEO of the Healthcare District. Darcy?
Thank you. Good afternoon. I'm Darcy Davis, CEO of the Healthcare District of Palm Beach County. For the past 32 years, the Healthcare District has served as the healthcare safety net for this county. All 1,300 of our employees are dedicated to the health of the community. So when Palm Beach County residents needed access to testing to help combat COVID, the Healthcare District stepped up. Since March of this year, we've expanded free testing from our biggest operation at the Fit Team Ballpark of the Palm Beaches to 8 sites throughout the county, including mobile testing in the communities. To date, with support of the Governor, the State Department of Emergency Management, the Florida National Guard, and of course, Palm Beach County, we've tested nearly 90,000 adults and children for COVID-19. That's quite an achievement, and as I like to say, that's a lot of noses. We are delivering on our mission to provide access to quality health care for all residents, including the underserved. But we know we need to test more. There is a need to increase testing to our residents who lack transportation or the time to travel, a need to test families close to home. Today, we introduce you to the newest member of our fleet, Hero. Our CL Brumbach Primary Care Clinics took Hero for its first outreach mission last week. This 38-foot clinic is similar in size and features to our other mobile unit, Warrior, which serves as an anchor at the Fit Team Ballpark. Our 3 clinics on wheels are staffed by a nurse practitioner, a registered nurse, 2 medical assistants, and 2 registration specialists, one of whom also serves as our driver. Hero, Warrior, and Scout have workspace for staff to prepare test kits, IT equipment to connect our patients' medical records, refrigeration, and other features like exam rooms. Each week, Mary Blakeney at the County EOC coordinates the locations for Hero and our smaller unit, Scout, based upon hotspots. You may have seen the medical team with Scout conducting in your own community, but we're also now at the South County Civic Center where we've taken over testing. I want to thank Palm Beach County Commission and the Division of Emergency Management for wisely using CARES Act dollars to support the purchase of both Scout and Hero. I also want to thank the Healthcare District Board, the CL Brumbach Primary Care Clinics Board, our Chief Medical Officer, Dr. Belma Andrick, and our outstanding clinic staff for the excellent work and support. I'm pleased to say that our Brumbach Primary Care Clinics are open again, and you can call 561-642-1000 to make an appointment for a clinic visit or to get testing. The hotline is open between 8 and 5, Monday through Friday, and our call center speaks English, Spanish, and Creole. In summary, the Healthcare District is proud to work alongside Palm Beach County and the Florida Department of Health to support COVID testing and a potential future with outreach related to vaccinations. Together, we're working hard to keep our community healthy. Thank you.
Thank you, Ms. Davis, for that and for your partnership and all the hard work you and your staff provide for the residents of our county. I'm going to now ask Dr. Alonzo to come up and provide you with a brief update on our numbers today.
Thank you very much, Incident Commander Baker. My pleasure to be here with you again. I really want to focus this on our hero and not so much in terms of anything else, but hero is here specifically to take care of the COVID. So just very briefly, our numbers in Palm Beach County as of last night, 49,298 cases, which represents 230 new cases, and 1,510 deaths since the beginning, representing 10 deaths from yesterday. But remember that those deaths will be put in the actual date of death, does not mean that we had 13 deaths overnight. The things that we're watching the most closely, and as I said at the Board of County Commissioners on Tuesday, our daily lab positivity rate has gone slightly up. It's trending upwards. Our total positivity continues to go down, going down by about 1/100 of a point each day. That's very good. We're at 12.34. We need to get down to 10 to be at the goal of the state. Our daily positivity as of Monday was 5.5, a little bit above the 5, but remember that that is going to fluctuate up and down. So while we're being cautious and we're paying very close attention to these numbers, there's no reason for panic and there's no reason for concern. We had 232 new cases, so that's a new high. We had been averaging about 147 to 170, and our average for the new cases has gone slightly up. But again, we need to be cautious. We need to be seeing and asking all the residents to continue doing the 3 things that we need to do. 1, wear your mask, maintain social distancing, continue to do sanitizing, washing your hands, and of course, getting your flu shot so that it doesn't get confused with COVID. And the 3 C's, crowded spaces, areas where you're in close contact with people, speaking to one another, shouting over music. We want to stay away from that. And we also want to stay away from enclosed spaces that might have poor ventilation. If we do that, we can keep our numbers down, folks. So we depend on you, the public, and all of you who are here today to continue pushing that message, to continue using your mask and social distancing so that we can keep our businesses and our economy going here in Palm Beach County. Thank you.
Thank you, Dr. Alonso. So you know why it's important for us to continue along the upward mobility of making sure that we are adhering to our face mask. Emergency Order 2020-12 has been extended by Emergency Order 2020-029, requiring facial coverings in Palm Beach County. This is mandatory facial coverings. And that is considering the most current data, as Dr. Alonso shared with us, for the COVID-19 spread. It has been determined that it is necessary and appropriate to extend our Emergency Order 2012 for an additional 30 days. Facial coverings must be worn by all persons other than those specifically exempted while obtaining any good or services or otherwise visiting or working in any business or establishment, including entering, exiting, and otherwise moving around within the establishment. Facial coverings must be worn by all persons in public places where social distancing in accordance with the CDC guideline is not possible, not being practiced. Also, social distancing is also, we're looking and requiring. Your 6-foot distancing, it is important that we distance ourselves. And to also look at enhancement of sanitation. We know that early voting started on Monday and will go through November 1st. So as we go out to our polling places, let's make sure that we have our facial coverings, that we socially distance, and we make sure that we utilize the hand sanitizer. As you go into the polling places, we've worked very closely with the Supervisor of Elections. She also has in place barriers that will protect poll workers and protect you as voters. So please, let's adhere to those particular rules. And further, the Palm Beach County Board of County Commissioners on Tuesday approved a $20 million additional funding and CARES dollars for our Restart Business Grant Program. We anticipate accepting applications on Monday, October 26th at 8 a.m. This is for businesses that have been impacted specifically by COVID, but were not shuttered as a result of executive orders by the governor or the county. And this will be on a first-come, first-served basis. The program guidelines include eligibility criteria, and that will be posted on the Department of Housing and Economic Sustainability website. Grants are up to $15,000 max based on 6 months of expenses. That will be an expanded list of eligible businesses that, again, were negatively impacted by COVID, and did not receive previous business grant awards through the county, and all PPP as well as forgivable loans will be applied against that maximum amount of $15,000. The county continues to provide CARES mortgage assistance as well as rental assistance. So please go to our website to adhere to the criteria in which you will be reviewed. We will also be continuing with CARES food and utility assistance programs that will continue to help our residents here in an emergency basis. Go to www.pbcgov.org. There will be a CARES specific item in which you will a link. It will take you to the appropriate site. There will be no appointment required for a drive-up rapid testing, and that is the Abbott test. It is now available at the Fit Team ballpark of the Palm Beaches. Tests are available for all ages with symptoms. The site will be open on Tuesday through Saturday from 8 a.m. to 4 p.m. Test results will be text to your phone within 30 minutes. That is the rapid test, but you must have symptoms in order to adhere to that particular test. COVID education compliance team will continue to inspect establishments. The team has processed 5,146 complaints. We're still getting complaints in every day, which totals of 7,400 complaints received to date. And education remains our focus, and that is to educate business as well as our residents on what is required when you frequent restaurants and any other type of business establishment. Again, we want to reiterate that we're still in an area in which it's important for us to wear face masks. They are mandatory in any type of restaurants or other establishments. And so we will continue to move forward. At this point, I will wrap up the session and answer any questions that you may have.
Steve, thank you. You have 25 minutes. What's the biggest difference between the Hero unit and then the other two mobile units that are already in operation?
So Hero and Warrior are actually very similar, almost identical, with only a few differences. Scout is the much smaller vehicle that doesn't require a special license to drive. It's a little bit easier to get into small communities, which is how we're using that one. But Hero and Warrior have a longer-term future because there's exam rooms in there. So right now, while we're testing, the patients don't go inside. We're doing all of the testing outside of the vehicles, but it allows us to have the IT equipment to access medical records, print labels, et cetera. But the long-term future for these is that we can still see patients as we did before, like in the homeless outreach or other venues. We responded for Hurricane Dorian with our vehicle as well.
And where will this be primarily located?
So we will move this around. This one, as well as Scout, are moving based upon the need as determined by the EOC here. They look at the hot spots and where we need to move into communities. Currently, Scout is spending 3 days a week at the South County Civic Site, and Hero has been scheduled through next week at various sites.
Can you talk about, or Dr. Alonzo talk about, where maybe some of those hotspots are currently in the county with that particular list?
Sure. I'll defer to Dr. Alonzo.
The question was, where are some of the hot spots? Right now, we have a map that we're using, census tracts, to track the number of new cases by week. And so we can look, right now, we don't have any of the greater numbers. We have kind of like the pink colored, it's about up to 24 cases. So it does not look anything like it did before, where we had hundreds of cases all at one time. But still, we're utilizing those. There was a couple of spots down in towards Boca, and we were looking at what was the population there. One of the reasons for probably a little bit higher than usual number is that there's a nursing home, or at least, let me put it, a long-term facility there that had some positivity. So when you have those kinds of facilities in some of the census tracts, that makes the numbers go up a little bit. But we're doing very well, and I think that we also want to work closely with the agricultural community. We're trying to have the ability to utilize the mobile vans to go out to the farms to be able to get a hold of the agricultural workers. We want to get a hold of the day laborers that are going to work, so that we can be proactive in terms of reaching that community that had the big spikes at the beginning of the pandemic last year, before they went off to other states to work. So we want to be able to get a hold of those people. So those are some of the ideas that we have now in terms of really catching it early on. Right now, with our daily positivity rate being below 5, we're being able to do very good contact tracing, and so we're able to catch that person that they're in contact with and have them quarantine at home so we stop the spread. It's very important to tell everybody out there, if you have a positive person in your home, all your household members should be in quarantine. Okay, it's isolation for the patient who is positive, quarantine for those members who may be possible contacts. Do not send your kids to school if you have a household member who is positive, okay? Because then that child could become positive at school, and then we have to send more kids home. So keep that in mind. Whether you are working, don't go to work if you have a household who is under quarantine also. So if you're sick, stay home. If you have a household member who is positive, the whole household should stay home. Thank you.
Any more questions? On behalf of the Board of County Commissioners, again, thank you for being here. And I want to publicly thank the board for their leadership, Mayor Kerner, Vice Mayor Weinroth, and all of the board members, because they had the vision to invest the CARES dollars into another vehicle, which is Heroes, that will service our community at this particular time.